It's no secret as you age, you begin to notice things changing a great deal with your body, and it's important to know what happens with testosterone as you get older. THV's Stephanie Bryant has more in tonight's Healthy Difference for Men.
Testosterone therapy helps increase muscle mass, boost libido, and improve energy levels. Knowing the risks before taking testosterone supplements can make all the difference. Joining me to talk more about testosterone and testosterone therapy is Dr. David Gerson with Baptist Health's Family Medical Clinic in Sherwood. Thanks so much for joining me. We'll start off with the simple question: what is testosterone?
Testosterone is a hormone that both men and women produce. You produce it from pretty much the time you're in your mother's womb and throughout your life. And you need it for you need it for a lot of important physical needs and for your health.
And what happens to our levels as we age?
Well, most people are not aware of it, but pretty much starting about the age of 25 to 30, especially in men, we do see a gradual decline in testosterone production.
And so what happens with low testosterone in men? How does it affect them?
Well, it is interesting. There's a very wide range, a very wide spectrum as far as what's a normal testosterone level. And if a low testosterone level, if it's going to present a problem for a man or a woman, you're going to typically have decreased energy, decreased sex drive. Muscle mass will probably be a little bit of an issue for you. You probably won't enjoy things as much as you have enjoyed in the past. But it's also just needed for strong bones, strong muscles, and also for your other organ systems.
Well, and I guess my question here is what's the difference? How would you know if, oh, I'm just having a bad day, I'm not feeling right, or there's something really wrong?
Well, I think it's a persistence. You know, everyone has a bad day here and there, but you should have a better day, you know, the next 2 or 3 days. I think it's important just during your annual exam, and we would encourage all adults to go see your family doctor, your internist, your PCP at least once a year. And if you're finding that, man, I'm just feeling fatigued, again, I'm just not enjoying the things I used to enjoy, or maybe you're exercising and don't have the endurance that you used to have, you might want to ask about, should I have my testosterone levels checked? And
what happens when men particularly boost their levels of testosterone?
Well, it's usually a pretty dramatic change. They can see a change as early as 1 to 2 weeks of starting medication. Sometimes it can take up to 6 months, but that's not typical. And so you'll see some vitality return, some improvement in your libido, your interest, and probably also an improvement in your muscle strength.
Okay. And what happens if there's too much?
Too much, specifically with men, you'll see the things like they were 13 or 14 years old again. You'll see acne, you'll see greasy skin, you'll see a lot of hair growth, and then you'll have irritability, agitation. I don't want to call it rage or those kind of things, but you probably won't be yourself. In women, I know it's something we're specifically talking about today, but again, they'll also show similar things: hair growth in places it shouldn't be, oily skin, irritability, that kind of thing.
All right, thanks so much, Dr. Gerson. We've added more information about testosterone and testosterone therapy on our website. Just go there today, THV.com.